I'm joined by Dr. David Wolinski, a cardiologist with Cleveland Clinic. He recently gave a talk at the Cayman Heart Fund Symposium called Cardiac Amyloidosis, an Unrecognized Afro-Caribbean Epidemic. Thank you so much for joining us.
Oh, my pleasure.
So before we get into why this is an issue in the region, can you just explain for all of us who don't know what amyloidosis is?
So amyloidosis is a systemic disease, which means it affects many organs in the body. The body makes these abnormal fibrils called amyloid that get deposited in the various organs, in the liver, in the nerves, in the GI tract, and particularly in the heart. Once they're deposited, the heart gets stiff, the heart gets thickened, congestive heart failure develops. The problem is it's not easily recognized.
Okay.
It is often felt to be kind of what we call run-of-the-mill heart failure with preserved ejection fraction, which means patients have little stiff heart from, say, high blood pressure or things like that. Instead of recognizing that they have neuropathy with the amyloid, they think that it may be diabetes-related disease. So this disease goes on longer and longer until the patients present very, very ill. Most of the patients that I see are already advanced, what we call stage 3.
What's the dangers of not being diagnosed until you're at that stage 3 phase?
Well, first of all, by the time they're at stage 3, quality of life is poor. Standard medicines have kind of lost the ability to be effective, not just from the heart, but they have neurologic problems, they're weak, they can't get around, they've lost a lot of weight, they require walkers, they're depressed. In addition to being short of breath, their bellies are swollen, their legs are swollen, which makes it a lot harder to them to carry the weight around, and they just feel miserable. And the prognosis, once you get to stage 3 and stage 4, is very, very poor.
Now, you spoke of this being an unrecognized Afro-Caribbean epidemic. Why have you termed it that way?
So, as I said, if you don't know to look for it, you don't find it. I think one of the things that made me so aware of it is because of the nuclear cardiology test that I described called the PYP scan.
Okay.
That makes it very easy for us to make a rather definitive diagnosis. We've also learned from the registries and some retrospective data that the mutant form of it is very common in Afro-Americans. 3 to 4% of Afro-Americans carry the gene that may cause them to have cardiac amyloidosis. And up to 10% of patients who have what we call diastolic heart failure may have amyloid. In particular, the disease is very virulent in the Afro-American population. So it requires really early recognition and kind of coordination of services, neurologist, GI doctor, cardiologist. In America, it's really fallen upon the cardiologist to take the lead in that because many other subspecialties have not. So we're really trying to educate everybody.
Is there a way that, you speak of if people are not aware of that or it's not on their radar, they might not go down that diagnostic path, even though the diagnosis, you have the tools to do it, right?
So, family history of unexplained heart failure, particularly in several members of the family, but not necessarily. That makes you think of it. One thing about amyloidosis, it's considered a rare disease, but there's an incredible amount of patient education out there for things like the Amyloid Society, the Amyloid Foundation, where people can begin to realize that. But hopefully, word of mouth works a lot. Sometimes it's bad with the internet, but somebody said, not feeling well, and somebody says, well, my friend went to Cleveland Clinic, they did a test, they told them they had amyloid, you may have it also. So it only takes a couple of people to become more aware of the disease before we can disseminate information.
So you're really, in a way, you're educating the general public who are the potential patients, but also your fellow doctors as well.
So absolutely, I call it teach the teachers. We have to teach the people who are not so aware of it so that they begin to teach patients, nurse practitioners, nurses, a variety of other people about the disease. We're never going to reach everybody, but if we could start by the first level, we can keep moving on.
Okay, and even just hopefully this interview today, people will start asking some more questions and digging into it a little bit more.
Exactly, and hopefully people will hear about this. you know, the Cayman Heart Fund disseminates an awful lot of information to people down here. People certainly will see that by their publications and their emails and their website and begin to learn and think about it, and hopefully they'll come for evaluation sooner rather than later.
And then what's the sort of treatment and prognosis when it is caught earlier?
So we have limited knowledge in that. There is one drug out that will soon be approved in America. We have it in a research study, but has dramatically decreased mortality, improved quality of life. I mean, you want to do two things. It doesn't pay to live longer unless you feel better.
Right.
And these drugs seem to do both. If you catch it early, you prevent the heart from being so saturated with this fibrils that it can't recover on its own.
Okay. Dr. Wolinski, thank you so much for joining us. Really fascinating information, and we hope that this sparks more interest in the future.
Thank you so much.
Thank you.